let's go into the anatomy of the spine. I'm going to show you a normal spine and a spine that has spinal stenosis. Some of the videos are going to be accompanied by some 3D imaging to kind of give you a better understanding of what's going on and kind of a better view of things. By better understanding the anatomy, you can understand what are the mechanics that cause the pain. This allows you to be armed with the information and how to seek conservative treatment for yourself. So on the right here, we have kind of a 3D model that I've kind of deconstructed to kind of follow some of the imaging of a normal lateral view of the lumbar. So kind of taking a look here, we can kind of see that this person does have good vertebral bodies. Nothing going on, nothing at all. Kind of following the line. They look pretty healthy overall. So it's kind of just showing you what we're following along here, kind of comparing it to what we're seeing over here. We've kind of pulled the hips out here so you can kind of see a little bit better. And overall, this person does look very... Now, the second 3D image, I've deconstructed a little bit more. So we're taking a look at the third, fourth, and fifth lumbar vertebrae. I've also cut them in half. We can see into the canal and see kind of what's going on. When there's certain issues, like I said before, some arthritic changes or degenerative, the disc may be pushing here. So let me pull up the disc. So now we can really see the disc here. So let's say somebody has some sort of changes, the osseous structures or a disc herniation. You can kind of see if it pushes back into the spinal canal, it's going to be pushing onto the nerves, which then radiate into low back pain, which can cause some of that radiation down the leg and some of that numbness, which is commonly associated with spinal stenosis. Spinal stenosis is not limited to specifically disc herniations, but as well as changes in the actual canal. So it's when that kind of canal kind of compresses onto it and causes more of that pain. So on the left here, we can kind of see that this person does have an issue caused specifically by a disc. So you can kind of see that the disc is actually pushing on the spinal cord. Not particularly the actual spinal cord, but the cauda equina there. So it may be causing some cauda equina syndrome. So if we take a look at the white here, this is a T2 weighted image. So T2 weighted images on MRI, all they mean is that they're water sensitive images. So anything with water, such as cerebral spinal fluid, will appear white, and then this is the actual cord here. We're kind of coming and it's kind of ending and then splitting up here, which would be the cauda equina. So we have to remember that the spinal cord ends at the inferior border of the L1 vertebrae of the lumbar vertebrae. So all that we're seeing here is the actual cord splitting up here. So cauda equina stands for horse's tail. You can kind of think of it as a brush. And as it splits up, it's kind of coming down here. So that's where you see that pain associated with spinal stenosis or disc herniation.